From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello, everyone. I'm Genaye Channel with my co-host, Dr. Madeline DiPasquale, neuropsychologist with the Drucker Brain Injury Center at Moss Rehab. And this is the Rehab Show. Our topic is how to keep our minds sharp as we age. So, this is an interesting topic. How do we keep our minds sharp as we age?
Okay, so everyone take a deep breath, okay? Normal aging begins over the fourth decade of our lives, but most of us don't begin to experience changes or notice that things are different until the seventh decade. But normal aging begins around 40, and there are changes associated with normal aging related to our processing speed and to our attention, and they can sometimes impact our ability to remember new things. There are also some sensory changes that come along with aging, right? More good news. Your vision may change, your hearing may change, and it may be harder for people to capture information to remember. So all those things factor into normal aging. It is important to differentiate normal aging from pathological aging, and that's a process that takes some time and some expertise.
So what are some things that people can do to keep their minds sharp as they continue to age?
A couple of good ideas. One is to stay intellectually curious. We want you to engage, take a class, learn something new, read books, do puzzles. Keep your brain busy and active. You also want to keep your body busy and active. Things like walking or swimming, yoga, even dancing, repetitive movements have been found to actually be preventative in terms of our aging. So keep your body engaged and keep it moving. And lastly, we want you to keep emotionally engaged. Meet with your friends, go to dinner, join a social group, a book club, a senior club. We want people to engage. Those are three really simple things that people can do to keep their brain healthy and active as we age.
Excellent. So is there such thing as a senior moment?
Oh my gosh, we all have senior moments, right? We all forget a word. Or how about when you walk into a room and you don't know why you're there? And there are lots of things that impact our ability to do things in the moment. The level of sleep that we've had, our mood, our level of attention. So we want to be cognizant of that when that happens. We also want people to know that there are several things that contribute to a senior moment. Your attention in that moment. If you're thinking about 8 million things when you walk into the bedroom to find something, the likelihood is that you're going to forget the thing that you went in to get. We also know that our mood and our level of sleep can impact our ability to attend. So if you're not getting good sleep, you may be having more senior moments. Just something to be aware of.
So is there a way that people can avoid having senior moments?
Well, here's a little strategy that I use, right? On the way to the room that I'm going to get something, I may actually repeat that because typically it's pretty rare for me to have one thing on our mind, just like you and the rest of the folks who are listening. So repeating what it is that you're going in for. Also, you want to sometimes walk out when you forget what you're walking into the room for, and that can actually provide a prompt. So you go back to where you started from and head back in, and that might actually help you remember what it is that you're looking for.
So can you give our viewers one or two strategies to help them remember information?
You bet. Here are two that I use, right? Write it down. Stop testing yourself. The more strategies that you use, the more room you allow for your brain to learn new information. So make a list when you go to the grocery store. Have an appointment book where you write down your appointments. Have a schedule or routine that you follow that's pretty much the same every day. Again, by reducing the demand on memory, you actually give yourself more room to remember new things. Another strategy might be to rehearse what it is that you need to remember. So saying it again, visualizing it, drawing a picture about it. Those things can actually help by being multimodal ways that we use to remember information. Say it, write it, see it.
Earlier you mentioned normal aging and neuropathological aging. Can you tell us more about that?
Yeah, I can. So, we know that there are normal changes that are associated as we age. We talked about those changes in sensory function, those changes in our attention, our changes in speed of processing. Pathological aging has a very different presentation. Typically for persons who are beginning the stages of dementia, they have difficulty performing activities that are routine and very well learned. So for example, they may have difficulty getting dressed in the morning, or they may forget to shower for days, or they may not remember how to make a very special meal that they made all of the time. Those are indications that something is changing and that you definitely want to see a healthcare provider about those issues. Don't be afraid to have the conversation. We want to engage with persons, especially if they're seeing changes in functioning. There are many reasons why that may be happening. It could be due to lack of sleep. It might be due to medications. We need to tease apart the reasons why so we can develop the best intervention to address those issues.
Thank you so much for sharing this great information.
Thanks so much for inviting me.
You're welcome. Be sure to watch more episodes on this topic and other issues of interest to all patients here on The Rehab Show. We will see you next time.